Thank you, Permanent Secretary. Your Excellency, Honourable Ministers, WR from Kenya, colleagues. It's a great pleasure to be here today to make some closing remarks on behalf of the World Health Organization. During this week, I think we have reflected on the fact that we live in extraordinary times, and they require that we apply new thinking. They require that we apply new approaches. And that is exactly what this conference has been about. Using what we know and applying it to get action. But one of the very difficult things about how you make change happen is, as the adage goes, if you want to change the world, you first have to change yourself. And if you want to see things change, you have to be the change you want to see in the world. And I think that's exactly what we've tried to achieve here in this conference. We took up the challenge of what would a health-promoting conference be about? And we've introduced a number of innovations. And the first one, and I think a number of colleagues have reflected on it already this morning, is that we've really promoted participation. And we've been absolutely delighted that our tracks have been so ably led by our regional colleagues, that subplenaries have brought together in intersectoral action a number of partner organizations and a number of departments across the World Health Organization itself. One of the things that we need to be able to reflect on is how others see us through their own eyes. And so I think it's been excellent to have our resident cartoonist reminding us that the world of health promotion is seen in different ways by different people. But very importantly, we've actually tried to reach out. We've reached out to a larger community. We've created our new social networking vehicle, Connect to Change, and it's really begun to give us a new power to connect to people. And it's the start of something very important. And I think, as my colleague Sharad mentioned earlier, we really want you all to join that so we can join together for change. But of course, this process hasn't been without its challenges, and I think a number of you reflected on that earlier today. Just as health promotion in communities is difficult, and you come across problems, so we have had challenges to deal with in this conference. But it's not the challenges that matter, it's how you deal with them. Dealing with them in an open and transparent fashion. And of course, at the heart of a participatory approach is one very difficult fact, that you have to give away power. You have to trust people to deliver something that is much better than you could have delivered yourself. And I just want to thank you all, because the trust that we placed in all of you in order to deliver a much better product, much better ideas, has been repaid in a way that none of us could have envisaged. And you've just heard some of that in the call to action. But of course, at the heart of what we really want to achieve is a very strong forward momentum. Our ambition is really to take forward the call for action, as you've heard, through the governance process for the World Health Organization, and to achieve our aspiration collectively of a global strategy for health promotion, which will in turn fire up action in our member states. But we're also very excited to be able to report on some very concrete and immediate follow-up action. We're delighted to be able to say here in Kenya next week, we will be working with our office on a workshop to take forward health promotion in this country. We're also delighted to hear this morning about how both you as individuals, but our regional offices and countries are going to be championing the approach, and particularly the approach that's going to be taken for Africa through the African Union. That's very exciting. We're delighted that our colleagues in the International Union of Health Promotion are going to help us by gaining momentum, not only in Colombia, but also in Geneva 2010. And I think it's very exciting indeed to know that with our Finnish colleagues, we can begin working, perhaps tomorrow or at least next week, on how we build the next conference, how we take forward the Nairobi call for action and make sure that it has an impact and make sure that it matters. Of course, there are many people that we need to thank. In particular, I would like to thank the Kenyan government for its unstinting support in helping us get here, the local organising committee, and of course the leadership of David Okello and the country office in Kenya. I'd like to thank all our sponsor organisations that are listed in our programme, the World Health Organization, all my colleagues in the regions, my fellow directors, Alamata, Haifa, and John, amongst many others, who have helped make this happen. I'd also particularly like to thank the African Regional Office, Alamata and her colleagues, and also that we're delighted that we can work forward with David Nyamoya on the conference report. But I guess it would be amiss of me if I didn't also thank my team in Geneva, who have lived and breathed this conference on a daily basis for longer than most of us would choose to remember. I'd like to thank them very much because they've really put so much into making this happen. And I'd like to thank one person in particular, and this is always difficult, but he definitely deserves it. Each day you've seen Gordon Gallia standing up here, dealing with the issues, working with you. You've got an even bigger fan club. When I went to the Western Pacific region recently, I was delighted to be able to be told that I was Gordon's director. It was delightful. But the reason why I wanted to thank Gordon, apart from all the reasons you do too, is because for me he really embodies the spirit, vision and values of health promotion. So thank you, Gordon. But of course, at the heart of what this has really been about, and what we've really tried to be this week, what we've tried to embody, what we've tried to do, is to be one global health promotion community, taking forward the vision, the values, and the principles that we care about for common purpose. And so I'd really like to thank all of you from the bottom of my heart for all the hard work you put in, for working with us, for supporting us, and for making it happen. And of course, I think the very best thing of all is I can leave you with your ideas, your words, and your vision within the Nairobi Call to Action. Thank you very much, and we look forward to working with you on the next steps.